Dogs can't tell you when they're feeling unwell, but their bodies and behaviors always send warning signals. Many health signs go unnoticed because they seem normal or not too serious. However, if detected early, you can prevent the condition from worsening and help your dog recover quickly. Today, we'll explore 10 common signs that indicate your dog might be experiencing health issues and needs immediate attention. Sign number 6 could be a dangerous warning. Don't miss it. Before we begin, don't forget to hit subscribe to stay updated with valuable information that keeps your pet healthy and happy every day. Dogs are naturally energetic animals, always excited to see their owners, eager to run, jump, and play. But if one day you notice your dog becoming lethargic, less active than usual, lying around all day, and losing interest in things they once loved, this could be an early warning sign of serious health problems. This condition can stem from various causes. If your dog has internal organ diseases like liver or kidney failure or an infection, they often become weak and inactive. Arthritis or injuries can also cause pain during movement, making them avoid activities. Beyond physical illness, even environmental changes, stress, or depression can lead to a loss of energy in dogs. So what should you do if you notice this sign? First, observe whether your dog has other unusual symptoms like fever, vomiting, or weight loss. Check their skin elasticity to see if they are dehydrated. If the lethargy lasts more than 24 hours without improvement, don't hesitate. Take them to the vet immediately for a proper checkup and timely treatment. The next sign you must not ignore is persistent coughing and sneezing. If your dog has a dry cough or frequent sneezing for no clear reason, stay alert. It could be an early warning of something more serious. Have you ever noticed your dog suddenly sneezing continuously or coughing persistently for no apparent reason? Don't assume it's just a minor issue. This could be a sign of something more serious than you think. Normally, if your dog sneezes a few times and then stops, it could be due to dust, pollen, or a strong scent irritating their nose. However, if the sneezing becomes more frequent, accompanied by a runny nose or watery eyes, your dog might be suffering from rhinitis, allergies, or even a respiratory infection. Similarly, persistent coughing isn't always caused by a foreign object stuck in their throat. Some dangerous illnesses, such as infectious tracheobronchitis, commonly known as kennel cough, pneumonia, or heart disease, can also lead to chronic coughing, especially at night. There are many possible causes for these symptoms. Allergies can stem from food, pollen, dust, or household chemicals. If your dog frequently visits crowded places like parks or pet hotels, they are at higher risk of contracting respiratory infections from other dogs. Additionally, brachycephalic breeds such as pugs and bulldogs have narrower airways, making them more prone to breathing issues and excessive coughing. So what should you do? If your dog only sneezes or coughs lightly for a short period, check their environment for potential irritants like cigarette smoke, scented candles, or dust. However, if the symptoms persist for several days and are accompanied by fatigue, fever, or difficulty breathing, take them to the vet immediately. Early treatment can help prevent more severe complications. If you've experienced this situation with your dog, share your story in the comments. Have you ever touched your dog's fur and been surprised to find unusual bald patches? Or noticed that their skin is peeling, red, and itchy? This isn't just an aesthetic issue. It could be a warning sign of underlying health problems. Seasonal shedding is normal, especially for thick-coated breeds like Huskies and Golden Retrievers. However, if your dog is losing fur in patches, has dry, flaky skin, or emits an unpleasant odor, they may be dealing with more serious issues such as fungal infections, parasites, fleas or mites, or skin allergies. Some endocrine disorders, like hypothyroidism or Cushing's disease, can also contribute to excessive hair loss. The most common cause is allergies, which can be triggered by food, environmental factors, or grooming products. Certain ingredients in dog food that don't suit their digestive system can lead to allergic reactions, causing inflammation and excessive shedding. If your dog frequently licks or scratches a specific area, it might indicate dermatitis or a localized infection. So what should you do in this situation? First, check for fleas or mites. If you find any, use appropriate treatment products. If you suspect a food allergy, try adjusting their diet by eliminating common allergens such as chicken or grains. Adding omega-3 and omega-6 supplements can also significantly improve skin and coat health. If the condition doesn't improve after a few weeks or worsens over time, take your dog to the vet for a thorough examination. If you found this information helpful, don't forget to follow for more important health alerts. Have you noticed that your dog has recently lost weight despite eating normally? Or, on the contrary, suddenly gained weight quickly without any changes in diet? Unusual weight changes can be a sign of underlying health issues. Sudden weight loss may be linked to conditions such as intestinal parasites, diabetes, hyperthyroidism, or even cancer. Your dog might be eating well but unable to absorb nutrients due to digestive problems. Conversely, uncontrolled weight gain can be related to hormonal disorders, lack of exercise, or an imbalanced diet. For example, if your dog is gaining weight but appears sluggish and inactive, it could be a sign of hypothyroidism, which slows down metabolism. If your dog is losing weight but drinking excessive amounts of water, diabetes may be the culprit. So, what should you do? First, monitor your dog's weight regularly and ensure a balanced diet. If there's a sudden and unexplained weight change, don't delay. Take your dog to the vet for an early checkup and necessary adjustments. Dogs often whine to get attention, but if whining becomes persistent, unusual, or is accompanied by strange behavior, it could be a warning sign of a serious health issue. Imagine this. Your normally active dog suddenly stays in one spot, whining softly when you touch it. This could indicate an injury, arthritis, internal organ disease, or even acute pain from gastric torsion, a life-threatening condition that requires immediate medical attention. Additionally, if your dog is whining along with trembling, loss of appetite, or difficulty breathing, it may be experiencing intense pain that isn't visible. In some cases, whining can also be caused by stress or psychological issues, especially if the dog has recently gone through a frightening event. What's the solution? First, check your dog's body for any injuries, swelling, or signs of pain. If you don't find anything obvious, but the whining continues, take your dog to the vet immediately. Early detection could save your pet's life. And don't go anywhere yet. The next sign might be something you never considered, but is extremely important. Have you noticed that your dog's eating habits have suddenly changed? One day it eats very little, then the next, it devours everything in sight? Don't dismiss this as just a random preference. This could be a serious health warning. If your dog suddenly loses its appetite and refuses even its favorite food, the cause could be digestive problems, dental pain, infections, stress, or even severe conditions like kidney or liver disease. On the other hand, if your dog eats a lot but continues to lose weight, diabetes, thyroid disorders, or parasites might be the reason. A real-life example. A dog that previously ate normally suddenly became picky, sniffing its food but refusing to eat. The owner thought it was just being fussy, but a vet check revealed severe gastritis. What's the solution? If your dog refuses food for more than 24 hours or has prolonged irregular eating patterns, observe for other symptoms such as vomiting, weight loss, or diarrhea. Take it to the vet immediately if any unusual signs appear. And most importantly, avoid making abrupt changes to its diet, as that can make the issue worse. Have you ever seen your dog suddenly panting heavily, wheezing as if it just ran a marathon, even though it was just lying down? This may not be as simple as you think. Sometimes, abnormal breathing is a desperate signal from your dog's body. Fast, labored breathing, without an obvious cause, could indicate heart disease, pneumonia, or heat stroke. If your dog is wheezing, it may have a tracheal issue or a foreign object stuck in its throat. Even more alarming, if your dog's gums turn blue or purple, it might be experiencing severe oxygen deficiency. At that point, every second counts. Imagine this. A dog keeps breathing heavily, but its owner assumes it's just hot or tired. By the time it gets to the vet, the condition has worsened, making treatment much more difficult. So, what should you do? First, check if your dog is in a hot environment, move it to a cooler place, and provide fresh water. But if the symptoms don't improve or are accompanied by fatigue and weakness, don't wait. Take it to the vet immediately. And be prepared. The next warning sign might be even more surprising, and you may have never realized how dangerous it could be. If your dog suddenly vomits or has diarrhea, do you assume it just ate something bad? The truth is, this could be a sign of a far more serious health problem. If your dog vomits repeatedly, especially if it contains blood or white foam, it could be suffering from an infection, poisoning, or even an intestinal blockage. Similarly, prolonged diarrhea doesn't just cause severe dehydration, but could also indicate gastrointestinal disease or a dangerous viral infection. You can monitor your dog and ensure it stays hydrated, but if the condition doesn't improve within 24 hours, don't hesitate. Take it to the vet immediately. Don't let complacency make the situation worse. But wait, there's one final sign that many dog owners overlook, yet it could be an early warning of a life-threatening condition. Have you ever noticed your dog constantly licking or biting its paws? If it happens occasionally, there's no need to worry. But if this behavior becomes frequent and persistent, it could be a sign of an underlying health issue. Excessive paw licking can stem from allergies, skin infections, or even stress. Many dogs develop allergies to food, pollen, or household chemicals, leading to itchy, irritated paws that compel them to lick for relief. In some cases, bacteria or fungi can enter through minor scratches, causing infections and making the licking worse. Additionally, psychological factors play a role. Dogs experiencing anxiety or boredom may lick their paws as a coping mechanism. If your dog is constantly licking or biting its paws, check for signs of swelling, redness, or an unusual odor. If you notice any of these, clean the affected area, evaluate their diet, and try to eliminate potential allergens. However, if the condition persists, it's time to visit the vet for a proper diagnosis and treatment.